عشان تتحرك من مكانها. تمام. أول حاجة البروتوكول for programming. protocol of programming that I follow in my clinic إن إحنا أول حاجة بنعمل first hook up and switch on. ودايما أنا بعمل ال first hook up within the first 4 weeks after cochlear implantation. In adults, I may begin at earlier time, but I prefer in children to make the switch on after 4 weeks of cochlear implantation. Usually, I need a first visit after 1 month after the first session to follow if the patient is using the device correctly or not. And then I do regular follow-up every 3 months in the first year, then every 6 months in the second. Requirements for programming that you have to know before starting any programming of cochlear implant or programming clinic. You have to know what are the requirements for doing this. First of all, you have to be familiar with the hardware and the software. So we have different companies that we deal with, and you have to be familiar and to know very well the software of each company. training courses وبيبقى فيه كل شركه بتقدم كورسز تساعد الناس انها تعرف السوفت وير واني ابديت، وبيبقى فيه انجينيرز معاكم بيساعدوكم ازاي نعرف اني ابديت حصل في السوفت وير. الحاجه الثانيه الهاردوير. you have to know the processor كمان how to deal with it, how to do troubleshooting, how to connect different parts of the speech processor before starting any program. The second important thing in programming that in each visit the patient comes to you, you have to check the incision site, the place of the magnet and the strength of the magnet, if it is suitable for the patient or not. And for any reason, if you find any swelling, edema or redness at these sites, you have to refer to the ENT surgeon or to ask for radiology if needed. Other important point is the place around you. The place should be away from any noise and away from any interruption. You have to use some toys to attract the attention of a child, for example, or you have to use some instruments to give stimulation to the patient and to check his responses during the programming session. Assistant is also very important during the programming session, especially for children, because you need the assistant to help you in the conditioning and to check the placement of the coil all the time, to manage the behavior of the child, to help you in the behavioral measures, and to help in observing the patient responses. Now we go to the parameters that we deal with during programming. We have some important parameters that we work with. All the parameters, most of them are set to the default, but the most important parameter is the stimulation levels, measuring the stimulation levels, and usually in each visit you need to recheck or to readjust these stimulation levels. The other parameters are usually set to the default of the software, except in few situations that we may need to change these parameters, and I will talk about each one in details. So first of all, we will talk about the stimulation levels, and this is the most important part. So what is stimulation levels? Setting the stimulation level means that you adjust the softest sound the patient can hear, which is known as threshold or T level, and to adjust the most comfortable sound that the patient can tolerate, which is known as the C level or M level, according to the software is in the apex and electrode number 1 in the base of the cochlea. And for each of these electrodes, you have to set the lowest level the patient can hear, which is presented in these green dots, and this is known as a T level, and the upper level that the patient can tolerate, which is presented by the red dots, and this is known as the most comfortable level. So these are the stimulation levels that need to be adjusted for each electrode. And the distance between the threshold and the comfortable level is known as the dynamic range. And this dynamic range is very important because it helps the patient to discriminate different speech sounds if it is adjusted correctly. This is another example from Medel software. Here the lower border of the, as you see in Medel, we have 12 channels, starting from number 1 in the apex and number 12 in the basal part of the cochlea. And and these are the levels here. The lower border is the T level or the threshold, and the upper border is the most comfortable level or MCL. This is another example from advanced bionics. In advanced bionics, we have 16 electrodes, and the electrode number 1 in the apex and 16 in the base of the cochlea. And these figure represent the T and C levels at each of these electrodes. So why do we need to adjust these stimulation levels? Because the patient is having a very narrow electrical dynamic range. The electric dynamic range is very narrow if we compare it to the acoustic dynamic range. So if we adjust it correctly, we will enable the patient to hear the soft sounds and also to tolerate all the sounds, and there will be nothing uncomfortable to the patient. So this is very important. So first of all, I will talk about the threshold adjustment or the T level adjustment, which is the amount of stimulation necessary to hear the soft sounds. And here in cochlear software, represented by these green dots. So T levels, if adjusted correctly, the patient will hear the soft sounds clearly. So what happens if you didn't adjust the T levels correctly? So if you set the T levels lower than needed for the patient, so the sounds will not be amplified enough to the patient. The soft sounds will not be amplified. يعني كأنك مثلا احنا عندنا patient عنده moderate hearing loss وادينا له mild gain hearing aid, so he will not be able to hear the soft